I'm Daniel Leas. I'm an orthopedic spine surgery, and I've been with Carolina Neurosurgery and Spine for about 4.5 years now. Degenerative disc disease is a very common age-related problem where the disc over time will start to lose some of its water content, and as that water content starts to go away, patients will start to notice a loss in disc height if you look at their MRI, or just progressive arthritic type changes. This is most commonly seen as the patient ages. I usually quote patients that it's about the percentage of their age. So if you're 50 years old, 50% of patients will have some degeneration. If 70 years old, 70% will have some degeneration. And it's also sort of synonymous with gray hair. As you age, you get a little bit of gray hair. It's not always a problem, but you will see that, and it's a common thing in our patient population. We don't fully know the primary causes of disc degeneration, but we do know that it's correlated with age. There is some genetic component, and some people who have had very physical lives or maybe some injuries in the past may have an accelerated rate of disc degeneration. Risk factors also will include people who have had other procedures that may have disrupted some of the disc material in the past. As the disc begins to degenerate, you may start to notice an increased risk for disc herniation, or as the disc degenerates, it also starts to maybe potentially cause some stenosis. The best analogy I typically give patients is that if you start to let the air out of a tire, the tire's still pretty normal, but it starts to bulge. And so as the disc loses water content, it starts to get a little bit shorter, almost like a flat tire, and that bulging can contribute to spinal stenosis. Whether or not disc degeneration causes back pain is one of the more difficult things that we as spine specialists face. Sometimes in coordination with our physiatry partners or our primary care partners, we have to do other diagnostic tests that may help outline or identify other possible causes of back pain that may not be related to disc degeneration, sort of like muscle spasms, little small facet joints that can be inflamed or irritated, things like that. Most commonly, I perform a whole spectrum of surgery, from small decompressive type procedures or larger deformity type corrections, and really anywhere in the spectrum in between, really for stenosis or instability in the spine. The first thing I try to help a patient decide and define is whether or not they have one of three major categories. There are some subtle exceptions to this, but typically I tell a patient that if they have impingement or compression of a nerve root, if they have instability either from a fracture or from arthritic change, or if they have a deformity, those are three big categories that surgery is very well proven to help. Outside of that, there are some other exceptions, but we start by looking at that, and then we look at patient-specific factors to help determine whether or not surgery is the right option for them. I think the most common conversation that I have with patients that is always helpful to highlight is degenerative disc disease is a normal process of aging. It is not in and of itself a problem, or does it necessarily cause symptoms. But it can, and that's where it's important to have that conversation to really understand why the patient is there presenting and what their symptoms are.